These two local business owners and a university president shared the same desire to serve and learn more about community health care.
I began my service to the Lancaster General Health Board in 2014, right when we were beginning our discussions with Penn Medicine, which was a very interesting time.
So I came on the board in 2001 when it was the Lancaster Alliance Board, and then it became the Alliance and the Hospital Board, and then it turned into the Lancaster General Health Board. So I've been through a lot of transitions in that 17, 18 years.
I first joined Lancaster General Hospital Board about 14 years ago, and then went on to the system-wide board a few years later. It was really exciting to be involved with this organization because we were going through a huge transformation after the year 2000. I was on the Penn Medicine merger team then that led to an acquisition with Penn Medicine and partnering with them, and today I serve on Penn Medicine's board of directors and Lancaster General Health's as their past chair.
I decided to join the board after I was invited for a couple of reasons. The major one is being a president of a public university. I felt compelled to serve as a role model for our students in terms of contributing to the community in which you reside. LGH has a huge image in the community. I knew it was a well-run organization. And for a selfish reason, I wanted to learn more about the healthcare industry.
I knew that it was an incredible organization that was extremely community-driven. And I knew some of the people that were on the board, and I was very anxious to learn from them and to get to know them better and to be able to serve the community from that perspective.
And the one thing that board service at Lancaster General really did was you came together with your leadership that you hired, and you made a commitment to this community. And that commitment to be a part of the community, to serve in the community, was so critical, and that's what I enjoyed most about our board service.
Strategic planning has always been my favorite part of what we do, and in my tenure there was lots of opportunity to work with Jan Bergen, particularly on strategic planning. A number of years ago, Jan spearheaded a group that talked about the experience of the patient and how hospitals and health systems needed to be cognizant of what the experience was. And it was something that at Kitchen Kettle we had talked about. We're very tuned into Disney and the experience, and people are on vacation in our business, so they want to have a good time. So that's what's paramount to us. So to have a medical system decide that that was something that was important really meant a lot to me, and finally I found a home.
The biggest takeaway and memory I have on the board as we made the transition from LGH to LGH and Penn Medicine merger. That was extremely interesting to sit as a board member and observe that transition and all of the variables and concerns that came up as a result of that.
In my term of service on Lancaster General Health's board, the system went through an amazing transformation. We built out the health campus. We built the wings of the hospital. We added to the infrastructure to create a really strong health delivery network for Lancaster County residents. Then the board made a decision to merge with Penn Medicine, and we brought in this really high-class, world-class healthcare system to provide even higher level of service. Bringing those two together was really exciting time for the board of directors to be able to look into the future and pick the right partner for us.
When I heard that I was going to receive this award, I was shocked. First thing that came to my mind was, why me? There's so many other deserving people. So very humbled by it, especially in light of the colleagues that I served with that I held in very high esteem. So I'm extremely humbled by receiving this award.
Receiving this award spilled up all the gratitude that I have for being asked to serve on this with this organization. People are totally unselfish in their service, whether it's board service, whether it's the medical community, whether it's the executive community. People really care about what they do and how they go about doing it.
Receiving this award is an honor, and I'm humbled that I've been recognized this way. In the 2 years I served as board chair, I was able to offer this award to others and was always impressed by their service to this community.
For excellence in board service, Penn Medicine Lancaster General Health is proud to honor Dr. John Anderson, Joanne Ladley, and Philip R. Wenger.